Hi, Todd Dunn here on Saturday, May 3rd, 2025 at about 1:30. Right now I'm sitting in the parking lot outside my wife's retinal specialist's office. She's in there having a minor eye surgery, something I wouldn't want to have done. They're sticking a needle in her eye. Ugh. Anyway, so I thought, since I'm sitting here outside a doctor's office, hopefully this helicopter will finish flying over. Okay, let me start over. Since I'm sitting out here outside a doctor's office, I thought I'd bring you up to date on what's going on with all the medical junk. The first thing is my knee on my right side, the knee replacement. As I have said in previous updates, I'm about 26 months out right now from total knee replacement on my right knee. The knee replacement itself is doing fine. I can bend my knee as much as I want. I can kneel. I have, full strength, no problems. But I have some sort of nerve issue that results in a lot of pain from just below the knee up into my thigh, and also my right foot gets numb over the course of a day. So my surgeon back in March x-rayed me a few times, got an MRI of my lower back, and referred me to a pain management clinic. And I finally got an appointment with them for this coming Friday. And hopefully they can do something about the pain in my leg, which doesn't seem to be associated with the muscles. I mean, right now it hurts. I can squeeze the muscles. That doesn't change how I feel. I can poke things and prod things, and everything is fine. It just hurts. And from the descriptions that I've read, it's nerve pain. And right now the thinking is that it's a consequence of some inflammation in the nerves where they come out of my spine and go down into my leg. And the problem is, it's been getting worse. Just since I saw the surgeon last in early March, it's significantly worse. And usually by the end of the day, my leg is just on fire. I can still do things. I mean, it's just no fun. Like a couple days ago, I was on board the boat and I crawled down underneath the cockpit and finished checking out the cooling system. Found some loose hose clamps, which I think were the source of the leak that I had. But, that involved a lot of bending and twisting and getting my body and knee into some odd positions. I could do that fine. But anyway, so I don't know what they're going to do to me. This is a, quote, new patient visit. I hope that they're not just going to evaluate me and give me another appointment to do something. I hope they're actually going to do something. I expect that on Friday I will either walk out of there with a prescription for a drug to combat the nerve pain. I have no idea what that would be, or that they will maybe give me a steroid shot. We'll find out. Okay, so that's one thing. Also, last week, I finally, after a year, went back to the urologist in connection with my prostate cancer scare. They've been bugging me to come back and get another PSA test. So I did that. I went back. My PSA had jumped up to 13.36. It had been at my last visit about 7.5. Prior to that, it had gone up to 10.5 and then dropped back down to 7.5. So it's up. And the urologist talked to me about it, and he wants me to get an MRI. So I've been referred last week, but so far I've not heard from the MRI center that they referred me to, which is in Bangor, and with an appointment. I have no idea when that's going to happen, but it looks like sometime in May or early June, I'll be making a trip into the big city for yet another MRI. And this will be the multi-parametric prostate MRI that will show if there's anything, going on with my prostate other than just enlargement. And I don't know if people recall, have a prostate biopsy 2 years ago that came back negative. So I'm hoping that the MRI will also come back negative, and that what my prostate issue is simply benign prostate hyperplasia. In other words, as an old geezer, my prostate has gotten bigger. So that's kind of where I am right now on that. And sometime in the next week or two, I should hear from the radiologists, and they'll schedule me an appointment. So that's kind of where I am right now. And the next step after that is I have a dermatologist appointment, again in Bangor, at the end of June. So lots of busy doctoring coming up. And I have to bring my wife back here to the eye doctor about once a month for these eye shots. She has macular degeneration, and they caught it early enough in her right eye so that there hasn't been any significant degeneration, but they missed it, the timing, in her left eye, and she's lost most of the central vision in her left eye. Although the shots are making it come back a little bit. She's probably gotten back, 20% of it. So anyway, that's what's up. And hopefully, everything will work out okay. The prostate MRI will be no big deal. And also, I hope that the pain management people will be able to do something for my leg. Because the way it is right now, well, if I have to do something, I can do it. It is not fun. And usually by the end of the day, the pain in my leg is kind of gone up, and my lower back hurts and my arms ache, and it's quite unpleasant. So hopefully that'll be straightened out next Friday, or in the absolute worst case, pretty soon after that, when they bring me back in for a follow-up visit. So I'm going to be driving into the city a fair amount in the next month or so. Okay, thanks for watching, and I hope everybody else is in better health than I am.